Panic anxiety disorder, otherwise called as PAD, panic anxiety disorder, or simply called as panic disorder. So, what happens here is a sudden and very severe attack of anxiety occurs here. It is a episodic in the sense panic attacks will come and they will go. So, several attacks may come in a one day, or there will be few attacks in a year. So 2 or 3 attacks in a year, or there will be several attacks, 4 or 5 attacks in a day. So it may vary from person to person. So what happens here is spontaneous and unexpected occurrence of panic attacks. Suddenly the person will start feeling uneasiness, palpitation, sweating, chest pain, breathlessness, muscle stiffness. So person feels like I am dying. There will be a anxiety. So that is known as panic attack. These all symptoms will not allow the person to carry out his day-to-day life activities, and they are existing with the person beyond the limits, and they are very severe. They are disturbing the day-to-day life activities of an individual. Then it is called as a panic disorder. Panic disorder. Panic attack means that particular episode of uneasiness, discomfort, and palpitation, breathlessness, chest pain, that sweating, all that episode is known as panic attack. So, if this panic attack is taking place 2 or 3 episodes in a day, or 4 or 5 episodes in a day, and it is taking place every day, and which is disturbing the day to day life activities of an individual, so person cannot carry out any other activities of his life, so then it is called as a panic disorder. Epidemiology of panic disorder. So again here, prevalence estimates they range from 1.5 to 5% for panic disorder. So 1.5 to 5% for a panic disorder. So, and then for a panic attacks it is 3.5 to 6%. So panic attacks are somewhat less dangerous than panic disorder. Panic disorder will disturb the life activities. Panic attack, it will allow him to carry out some of the activities. So the prevalence rate for panic disorder is 1.5 to 5%, and for panic attacks it is 3.5 to 6%. And then if you compare the male to female ratio, so females are suffering from this panic anxiety disorder more than males, 2 to 3 times more than males. All these neurotic disorders which we are discussing under this category, F402, F48, neurotic, stress related, and somatoform disorders, are more common among females. So, this panic attack is also more common among females only. And then panic disorder has a bimodal distribution. Bimodal distribution means there will be a peak level of panic disorder during the adolescent age period. Again, it will come down and the person will be without any panic attacks. And again, around the mid 30s, means 35 years around, again he will start getting one more episode of panic attacks. So bimodal, it is called as bimodal. In the life process of an individual, the person is suffering from panic disorder 2 times, around the age of 18 or 20. Again, after the recovery, again he may suffer from panic disorder around the age of 35 years. That is called as bimodal distribution. So this is all about epidemiology of panic anxiety disorder, panic disorder otherwise called as. Positive factors of panic anxiety disorder. So first and foremost thing, we can blame the genetic factors. So this panic anxiety disorder also runs in the family. So we can assume that there are some genes located on chromosomes, they run in the family. So this panic anxiety disorder is a having a hereditary factor. It runs in the family, genetic factor. And then it also takes place as a comorbid condition in association with bipolar mood disorder. You might have discussed bipolar affect disorder, BPAD. So mania and depression, they are alternatively in alternating episodes. They are present in a single individual, that is known as bipolar affect disorder. And even the people who are addicted to alcohol, so they also exhibit this panic anxiety disorder. Those people who are predisposed by genetic factor to alcoholism, they also represent this panic anxiety disorder as a comorbid condition. And then even some of the malfunctioning of the brain structures like amygdala and hormonal adrenaline glands. So amygdala and adrenaline gland malfunctioning, so also can lead to a panic anxiety disorders. And then imaging studies, they say that around 10 to 20% of the GABA functioning in the brain has reduced. So if you do the MRI, if you study the imaging study of the person who suffers from panic anxiety disorder, so they have shown it that a GABA level has reduced to around 10 to 20%. I told you GABA is an inhibitory neurotransmitter, so it will calm down the mind. So if it is in a normal level, it can control our anxiety, stress, and all. So among these people who are suffering from panic anxiety disorder, what happens? 10 to 20% of GABA has reduced. So some of the conditions such as hypoglycemia, hypothyroidism, mitral valve prolapse, labyrinthitis, so middle ear infection, or the infection of the nerve line which carries a nerve impulse from ear to brain. So that is known as labyrinthitis. And next, pheochromocytoma. So also is a tumor of the adrenal gland which starts secreting more and more adrenaline and noradrenaline. So which leads to hypertension and all. So panic anxiety disorder or panic attacks are seen in such a conditions: hypoglycemia, hyperthyroidism, mitral valve prolapse, labyrinthitis, and pheochromocytoma. And next, some of the psychological factors such as stressful life events. So any burden of a family process or a business or any work condition, so any stress of the life can lead to panic anxiety disorder. And then the life transitions. So newly married woman, so girl, she enters into a new family, so suddenly there is a need of new adjustments. So that transition, so she was a bachelor, she became married, so a lot of changes she needs to undergo. So during that period also it is seen. From adolescence to uh, adulthood, so transition of a life, so that also puts a pressure on mind, and the people start exhibiting panic anxiety disorder symptoms. And some of the environmental conditions also, they lead to a problematic panic disorder. And then these are all some of the conditions which lead to a panic anxiety disorder, causative factors of panic disorder. Symptoms and signs presented by the person during panic attacks. So palpitations, pounding heart, accelerated heart rate. So there will be an increased secretion of epinephrine and norepinephrine. Sympathetic nervous system gets stimulated because the person suddenly gets uneasiness and he will be under stress. So all those symptoms will be presented: increased BP, heart rate, and palpitation will be there. Even there will be a sweating, and there will be a tremors, and then sense of shortness of breath, means there will be a difficulty in breathing, feeling of choking, chest pain will be there, discomfort in the abdomen will be there, and chest discomfort will be there. And next, nausea, abdominal pain, that all will be there, and the person may feel dizzy, unsteady, lightheadedness, so that all is seen. And then next is derealization and depersonalization are also seen during panic attack. And then fear of losing control or going crazy, the person feels that I am going mad. So then fear of dying, the person says that I can't survive, I will die within a short period of time, so I can't control this. They start crying like anything. And then numbness or tingling sensations, there will be a numbness and tingling sensations in the extremities. And then chills or hot flashes, the person may feel chills or he may feel that hot flashes. So these are all some of the group of symptoms presented by a person who suffers from panic anxiety disorder. Diagnostic criteria given by DSM 4 TR. So, some of the criteria to fulfill to make a diagnosis. So, which are all those diagnostic criteria given by DSM 4? So, let us see them here. So, if the person is exhibiting the recurrent unexpected panic attacks, so he needs to get a recurrent unexpected a panic attacks, acute, suddenly, without any warning, without any expectations, the person is getting a panic attacks. So that is a one criteria. And the second criteria here it is, at least one of the attacks has been followed by 1 month of one of the following. One of the panic attack has been followed by 1 month of one of the following. So there are some following points here. So the after an panic attack, the person was persistently concerned about having additional attacks. Means the person was worried and he was having a concern that I may get another episode. It was very painful, so I have passed it now, but I may get it at any time. So within a month, she was, I will use she because it is very commonly seen among females. So she will have a concern about having one more attack very soon. So if you find this, it is also one criteria. And then worry about the implications of the attack or its consequence. Very much worried about that implications, very painful it is if it comes again. So I may lose my life, I may die. So they will go very crazy. So that extent they are very much worried. So they are persistently concerned about one more attack and they are very much worried about the implications of that attack. So there will be a change in a behavior of an individual. Significant change has been seen after the panic attack. These are all some of the criterias. First one, recurrent unexpected panic attacks, and second one under that, any one among these persistent concern or worry or significant change in a behavior. Anyone, if you see, you can make a diagnosis. And there needs a presence of agoraphobia or there is no need of agoraphobia. So most commonly what happens is panic anxiety disorder gets associated with agoraphobia. Agoraphobia is also seen with panic anxiety disorder. What do you mean by agoraphobia? So, threat of being in a unfamiliar places, any place which leads to a, a threat to the life. The people feel like anxiety about the places, unknown places, and all. So the person is not willing to go in a place where he is not comfortable, like in a dark room or a place where he is not known about that place. So they avoid such a places, that is known as agoraphobia. So most commonly panic anxiety disorder is associated with agoraphobia. And next is panic attacks are not due to the direct physiological effects of substance use. So sometimes what happens, panic attacks are seen among those people who use alcohol or opioid drugs or narcotic drugs. It is not due to alcohol abuse or any drug abuse. This is also one of the diagnostic criteria. And even this panic attack is not due to any other medical conditions like hyperthyroidism or anything else. So you have to rule out all the differential diagnosis. A similar symptoms of panic anxiety disorder are seen among those people who use psychoactive substances like alcohol, narcotic drugs, opioid drugs, and all. So you should rule out that. And then the same panic attack symptoms are seen among those people who are suffering from some of the medical conditions such as hyperthyroidism. You should rule out that also. If the panic attack is due to hyperthyroidism, treat that hyperthyroidism, automatically panic anxiety disorder will go away. So that is different one. You should rule out all the probable causes for panic anxiety disorder. You should find out them. And then some of the mental disorders also get associated with panic anxiety disorder, such as social phobia, specific phobia, obsessive compulsive disorder, post traumatic stress disorder, and separation disorder. So if the panic attacks are due to these all mental disorders, then you cannot make the diagnosis as panic anxiety disorder. Primary diagnosis comes obsessive compulsive disorder. If panic attack symptoms are there in an individual who is suffering from obsessive compulsive disorder, so under that heading you will treat panic symptoms. So the main diagnosis becomes obsessive compulsive disorder with panic symptoms, like that. So you have to rule out the differential diagnosis, and you have to find out the exact criterias. If you find these criterias, you can make a diagnosis of panic anxiety disorder. Treatment of panic anxiety disorder. So they use drugs, that is medications, pharmacotherapy, that is, and cognitive behavioral therapy also can be used in the treatment of people who suffer from panic anxiety disorder. Psychological treatment modalities also are used. So let us see which are all the drug medications used in the treatment of panic anxiety disorder. Let us see. Selective serotonin reuptake inhibitors are used. Sertraline, so is the drug of choice here in our hospital. They use sertraline, selective serotonin reuptake inhibitor. They are antidepressants. They block selectively the reuptake process of serotonin in the synaptic cleft. That's how they increase the level of serotonin in the mind. So whatever they say is, decreased level of serotonin is also one of the cause for panic anxiety disorder. They try to maintain the level of serotonin in the brain by giving SSRIs, so antidepressant it is. And then benzodiazepines, they increase the level of GABA. By that they will control the anxiety. And then sedating antidepressants like tricyclic antidepressants are also used, like fluoxetine and all. And then commonly used medications are lorazepam around 0.5 to 1 milligram IV or IM, or 1 to 2 milligram per orally BD or TID. And then clonazepam is also used, 0.5 to 2 milligram per orally BD or TID. And then paroxetine, 10 to 40 milligram per orally at night during bedtime. So these are all some of the group of drugs, medications which are used to control the panic attack. And then psychotherapy, such as the cognitive behavioral psychotherapy, means what happens here, the people are having some distortions in the thought process. So in cognitive behavioral therapy, what you do, you will change the pattern of thought process. What is the problem with the thought process, you will assess it, you will discuss regarding that all thought process, and you will make modifications in the way the patient thinks. So by modifying the thought process of the patient, you can modify the behavioral changes. So that also can be used. Psychodynamic psychotherapy, like psychoanalytical therapy, you will dig into the past, you will discuss regarding the past experiences and all those conflicts and unsolved questions or any painful experience of the childhood, all that can be discussed and resolved. That also can help the people to recover from the panic attack. And then relaxation techniques are also taught to the person: meditation, yoga, pranayama, exercise, jogging, listening to music, watching movies, talking to family members. These are all some of the relaxation techniques which can be educated to the person to use them during panic attack. And then respiratory training, breathing exercise, you can also train the person. Interoceptive therapy is there. So what happens is, the patient is made to experience the similar symptoms of panic attack in a controlled setting, controlled environment. So how they do is, they just induce the symptoms of panic attack and how to manage them when they really occur during panic attack. That all is trained for the patient. So how they can induce the symptoms, let us see. Intentional hyperventilation, you will make the patient to hyperventilate, taking in breath, giving out breath, so more number of times, so increasing the breath rate, hyperventilation. And then spinning in a chair, you will make the patient to sit in a rotating chair, and you will rotate the chair. That leads to dizziness and disorientation. That also can lead to a panic attack symptoms like. And then straw breathing, you will make the patient to keep the straw in the mouth. You will ask him to take in breath through that straw and give out breath through that straw. So that also will lead to some difficulty in breathing, that is airway constriction. And then breath holding, you will ask the patient to hold breath for some time. And then running in a place, like you will ask the patient to run around. That also leads to some similar symptoms of panic attack. And then body tensing, you will ask the patient to keep the body muscles in contracted state. You will ask him to maintain the stiffness in the muscles. So these all some of the methods used to induce the symptoms of panic attack. So just in a controlled environment, everything will be there. The therapist will be standing in front, and he will ask him to practice these activities so that the panic symptoms will arise, and how to manage those panic symptoms in a controlled setting. That all will be trained to the patient in a controlled setting. So this is all about the treatment of a panic anxiety disorder. Prognosis of the condition. So usually generalized anxiety disorder and panic anxiety disorder, they will be having a good prognosis if the patient adheres to the treatment, medical treatment. So he will recover completely without any problems. So prognosis will be very good for all neurotic disorders. So what we are discussing here, stress related somatoform disorders, neurotic, stress related and somatoform disorders. Under this category, almost all conditions, they have a very good prognosis if they adhere to treatment. If they are not adhering to the treatment properly, so it will be very troublesome. So the people cannot lead happy life. It is very problematic. So adherence to the medical treatment is very important. And then next is patient education. What all psycho education, health education in relation with the mental aspect is known as psycho education. You can give to the patient. Let us discuss some of the points under this heading: psycho education to the patient who is suffering from generalized anxiety disorder and panic anxiety disorder. So first thing is, you should educate the patient potential adverse effects of their treatment medications. So regarding the treatment modalities, you should explain to the patient. You should take the consent also of the patient. We are going to start so and so medication for to control your symptoms. You are suffering from panic anxiety disorder or generalized anxiety disorder. So to treat that symptoms, we need to start these drugs, and these drugs have some side effects also. You may encounter some of them in future. So like that and all, you will explain the importance of starting these drugs, and even some of the adverse effects regarding that also you should educate to the patient. The patient should know everything. And then obtain a informed consent. I told you, you should inform everything, then take a consent. That is known as informed consent. And then document the discussion. Whatever you are discussing with the patient, you should record it, or you should document it in a paper. If the person is suffering from any biological problems or psychosocial problems, so that may lead to panic attacks again, generalized anxiety disorder again. So that needs to be educated to the person. And then you will ask the patient to avoid anxiogenic substances. Anxiogenic means anxiety generating substances, such as coffee, energy drinks which contain preservatives and coloring agents, and chocolates, and over the counter drugs, or any other stimulant drugs which are used to recreate themselves, like lead to episodes of panic anxiety disorder. So if there is any problem in thinking process, that may lead to the symptoms of panic anxiety disorder. So correct your thoughts, keep your thoughts in a controlled manner, think positively, act positively, control your emotions. Everything will be fine for you. You should educate regarding this to the patient. Triggers means make the patient to understand what is leading, precipitating the panic attack. So ask him to recognize and stay away from it. So like a bright light or a noise or a wind of air. So if they are the acting as a triggers for panic attack, ask him to control them. It is an environmental manipulation. They can control it. Alcohol consumption and recreational drugs, they also have a bad impact on the course of panic anxiety disorder. And then adherence to the therapy, it is very important. So early, if you start the treatment, there will be a better recovery. And the without interruptions, if the person is taking the treatment as prescribed by the doctor, there will be a complete recovery. If they are changing the drugs on their own, if they are changing the dosage of the drug on their own, or if they are skipping off the dosage in between, then it will lead to a very problematic condition in future that cannot be managed with the ordinary drugs. That all needs to be educated to the patient. The nursing management of a patient with anxiety disorders, both generalized anxiety disorder and panic anxiety disorder, you can handle commonly. All issues will be somewhat similar. So let us discuss them here. First thing is nursing assessment. So if you assess, you will identify the problems. You can collect the information from the patient, and you can recognize the problem areas, and you can deal them effectively. So that first step is nursing assessment. So you should collect in-depth information, that is called as history taking. So you should assess the all probable causes of the panic anxiety disorder by collecting the information. So family information, socioeconomic status, educational background, past history, or past psychiatric and medical history. So pre-morbid personality, how the person was before suffering from this condition, all that can be studied in detail in the first step. And then you can do the physical and mental assessment also. Mental status examination and physical examination you can carry out. So some of the symptoms are presented by the patient, they needs to be evaluated in depth. If the person is telling chest pain, so you need to take ECG, and you need to listen to the sounds of heart, and even you need to listen to the breath sounds also, because you need to rule out all the differential diagnosis. If the person is acting in a particular way, and similar to the panic anxiety disorder, and if you make a misdiagnosis, if he is having a real heart problem, you should rule out that by taking the ECG. So for that purpose, physical and mental assessment needs to be carried out in detail, and all the probable investigations, blood investigations, and even a ECG, MRI, CT scan. So you should carry out all the investigations to rule out the differential diagnosis. So you should not make the wrong diagnosis. So it will help you to make a right decision about the condition. Next is nursing diagnosis. Let us discuss some of the noted problems of anxiety disorder. That is, first one is anxiety. So main central symptom of generalized anxiety disorder and panic anxiety disorder here is anxiety, uneasiness. So the person is discomfortable, so feeling threat to his life, all that will be here. And then next, expected outcome will be client will be able to recognize the symptoms and will be able to prevent the anxiety to reach at a panic level. So that is going to be your expected outcome. So what are all interventions you can give for to control the anxiety reaching to panic level? So let us discuss. So first thing, you will assess the level of anxiety. and then stay with the person and keep on reassuring him. So everything will be there for you, don't worry, I am here to help you, I am here to take care of you. If you have any problem, talk to me, I am here. You are in a safer environment, there is no threat for your life. Doctors are here, I am here always for your help, and there is no harm for your life. Don't worry, your life is at safer side, don't worry. Keep on reassuring the person, and then maintain calm and non-threatening environment. So you should keep the environment very calm and quiet and non-threatening. And external stimuli you should keep low, means brightness of the light or wind of air, so they all can stimulate panic anxiety disorder. So you have to control all of them. Any sound, noise also can stimulate the panic attacks, so you should control them all. And then use simple language in a calm manner. Establish a trusting relationship with the person, so that he can talk everything to you, and she can rely on you. And then once the client is established a good relationship, then explore the possible reasons for anxiety. What might be the cause? You can recognize by discussing in detail about the problems. And then teach various relaxation techniques like breathing exercise or meditation, yoga, pranayama exercise. You can suggest the person to relax during panic attacks. And then use of anti-anxiety medications like benzodiazepines. Any it might be a Librium or chlordiazepoxide or diazepam or lorazepam. So any antidepressants are, if prescribed by a doctor, you can give them also. So that is to deal with the anxiety. And next problem we can find out among the patients suffering from anxiety disorder, that is perceptual disturbance. So the patients most commonly they will be having a disturbance in perceptual process. They are not understanding the reality in a real manner. There will be some problem with understanding the reality. So you will help him to understand the reality in a real manner. So you have to assess the level of perceptual disturbance and orient the person to surroundings, time, place, person, all rules, regulations, routine activities, where is a toilet, where is a dining hall. So everything needs to be explained in detail to the person, so that there is no confusion about anything for the person. Timing of the breakfast, timing of the lunch, dinner, timing of the tea, or timing of the medications, or timing of the visits of doctor and nursing officers. So all that can be educated to the person, so that that will decrease some extent anxiety among the people, and the person can understand everything realistically. Perception also improves. And then encourage the client to concentrate in a diversional activities like working in a garden, or playing with instruments, or playing music, listening music, watching movie, reading magazines or newspaper. So according to his interest he can involve in some of the activities, so that he will get little time to concentrate on the symptoms. Empty mind is the devil's workshop, you all know. If you won't give them work, they start thinking about the symptoms. Oh, again panic attack may come. So they are worried about that only. So make them busy by giving some activities, and then motivate the person or patient to perform some of the interesting activities. That same I told of perceptual disturbance, continue that. Motivate the person to involve into some diversional activities, and some of the activities where he has a interest, like painting or gardening or any other activities, like working in a kitchen. Or so make them busy, so that they won't get enough time to concentrate on the symptoms of panic attack. If you won't give any work, they go on thinking about that panic symptoms. They may worried about another attack of panic episode. And then encourage the client to discuss about their anxiety with the family members, and you also listen to the patient carefully and ask the patient to talk about his anxiety with the family members openly. And then observe the client for self harm and protect him. So if the person is very dangerous to his own self, if he is causing any harm to himself, protect him by giving safe environment, and then utilize the family and community resources in the care of the person. So there will be some community helping agencies or associations. You bring them all in the care of the patient, and even all the family members, you should utilize them in the care of patient. They can help him in controlling the symptoms of panic anxiety disorder by improving the perception, and then administers medications according to the prescriptions. So next problem which is encountered very commonly here is impaired communication, some problem with communication pattern. So expected outcome is client will be able to recognize, improve in his communication, and will be able to socialize himself in a proper way with all others. So what all interventions you can give to such a patient is assess the level of communication and social interactions, what level he knows and how he is interacting with all the people in a society. Assess that, and then establish a free and open communication with you. Make the patient to talk, and even with the family members, so the patient can learn how to talk properly with all others. So you will be giving some suggestions and modifications to the communication pattern, so that may help the person to communicate in a proper way with society people. And then motivate the client to discuss and interact with all the members in the group therapy you will be using. So the people who are facing with the same problem, they are made to sit together in a one place. Around 10 to 15 people are made to sit together, and they discuss about their problems and they find the solutions for themselves. So in a group itself, so that you will make him to involve in a group activities, and then provide calm, quiet, and non-threatening environment, and then allow the client to express all his feelings and emotions. As you all know, if you share your sorrow, it will get hauled, it will get reduced. It is just a ventilation of all the bottled up, pent up emotional problems. That gives some relaxation, release from tension. And then encourage family members to support him. So ask the family members to spend time with the patient and spend money on his treatment and give him respect. So that is most important thing. Person needs to feel important, loved, and he needs affection, love and affection from the family members. And next is provide a safety and security to the client so that he will not harm himself. And then assist the client in cognitive behavioral therapy. Make his all thoughts somewhat in a very good way, constructive, positive thoughts. You have to keep, remove all negative thoughts, and distorted thought needs to be corrected in a cognitive behavioral therapy. And then encourage the client to perform group activities, we have discussed earlier, and then administer the medications as per the prescriptions. This is all about improvement of communication and improvement of perceptual disturbance and correction of anxiety. This is all about nursing management of a patient with a generalized anxiety disorder. Three main problems encountered here, they are anxiety, perceptual disturbance, and impaired communication.